Hi, my name is Vanessa Graves, and I'm doing my staff project on colorectal cancer. And what is colorectal cancer? It's an abnormal growth or a tumor in the colon or rectum. The colon and rectum are located in the large bowel, and the large bowel is the fourth common site for cancer. Other three sites that cancer can occur are the lungs, the breast, and the prostate. How does it occur? Most of the colon cancer starts from a small polyp, and a polyp is a growth of extra tissue in the lining of the bowel. Most common places of colon cancer are in countries where obesity is common and lifestyles lacking regular exercise. So when you don't exercise regularly, you're at risk for colon cancer. So you have greater risk for colon cancer if you've had colorectal cancer before, you've had breast cancer, ovarian or uterine cancer before. If you have polyps, while they do screenings to check for polyps. If you have a parent, brother, or sister that has colorectal cancer, your diet is high in fat and low in fiber, you smoke, and you have inflammatory bowel disease. An example are like Crohn's disease or ulcerative colitis. So what is a screening? Is whenever you look for cancer before you have the symptoms. It helps to find cancer at an early stage when it's easier to treat, and it may be repeated on a regular basis. 5 tests used for screenings are the fecal occult blood test, a sigmoidoscopy, a barium enema, colonoscopy, and a digital rectal exam. Studies show that screening for colorectal cancer helps decrease the number of deaths from the disease. What are the symptoms? At first there's no symptoms, then you start to find blood in your bowel movements, which is your stools. You have diarrhea or constipation. You have a feeling like you don't empty your bowel completely. Stools are narrower than usual. You have gas pains, cramps or unusual feelings of fullness in your abdomen, feelings of tiredness all the time, and an unexpected weight loss. How do I know if I have it? Your doctor will test for a sample of your bowel movement doing the fecal occult blood test, and then you may need a colonoscopy, which is a thin, flexible, lighted tube is inserted into your anus to view the inside of the bowels, which is your colon. And if needed, they'll take samples of biopsies for testing to look for abnormal tissue. And you may need a double contrast barium enema, which is a fluid-containing contrast, which is put into your colon to view the inside of your colon. And the treatment for it, first it must be staged. A number that is best describes the amount of spreading. Surgery may be an option to remove the cancer. Surgery may be an option to remove the cancer. Procedure called a colostomy may be needed, chemotherapy or radiation treatment. How long will the effects last? If detected early, surgery may cure it. If detected late, treatment needed at all cancer is gone to lessen the chance of it returning. Chances of cure depends on how much it has spread. And if a colostomy is needed, your healthcare team will educate you and your family on your colostomy. How can I take care of myself? Get enough rest and sleep. Eat healthy foods. Follow your aftercare surgery diet instructions. Exercise according to your doctor's instructions. Do fun activities to relieve stress. How can I keep it from returning? Keep all of your follow-up appointments. Have routine colonoscopies to check for polyps. Follow your doctor's recommendations. Check yourself for signs and symptoms and call your doctor if any changes occur. Your recommendations: if you have a higher than normal risk of colorectal cancer, ask your doctor about when you need your yearly colonoscopy. You may need to start earlier. If you're over the age of 50, you have an average risk for colorectal cancer. Get your stool checked for yearly fecal occult blood test, a colonoscopy or sigmoidoscopy yearly, another sigmoidoscopy every 5 years, or colonoscopy every 10 years afterwards, if you have higher than normal risk. So if you have normal risk, these are the recommendations. For more information about colorectal cancer, you can call the American Cancer Society or go to their website. The American Cancer Society, Cancer Research Center and Foundation, or the Cancer Information Services. Any questions?